Hi guys, my name is Alana. Welcome back to my YouTube channel. If you're new here, make sure you click that red subscribe button and give this video a thumbs up if you enjoy it and want to see more from me. So without any further ado, let's get on with the video. So for today's video, I was going to be doing a mental health video and I thought that it would be really interesting just to make a hopefully short video on medication for mental health and just my views and just some facts and stuff that you might want to know. Maybe you are considering going on medication, or maybe you're not really sure whether you want to or not, and this video could probably just help you just kind of weigh out the pros and the cons of it. And I'm also going to be giving my personal experience just to kind of help with this. So to start off with, I'll just put this out there first so you understand kind of where I'm coming from. So I started taking antidepressants, specifically fluoxetine, in I think it was the beginning of February, and it is now getting closer to the end of April, so I think it's been like 2 months kind of thing. So I started taking them only like a low dose. I've actually had issues with anxiety, quite severe anxiety and depression for many years, but I never got treatment for it until recently. And medication was always something that I thought I didn't really want to try. I didn't really want to go on it, and I was actually quite against it, to be honest. Just personally, like other people I didn't mind if they went on it, but for me personally, I was a little bit like iffy about it. But I'll kind of explain more as I get into the video, the reason why I changed my mind and stuff. But I just wanted to start off with giving some basic information of medications. Now, there are a lot of different types of medications for mental health disorders. So I'm specifically going to be talking about antidepressants because this is the only medication I've had personal experience with. There are so many other things. There are ones for like anxiety, there is medication for schizophrenia, there's mood stabilizers. Like there is a large range of stuff, but I will not be discussing them because I don't have any personal experience, so I feel like it wouldn't really be that helpful. But as far as antidepressants go, obviously as the name suggests, they're usually used to treat depression. They can be used for anxiety, but in my personal experience, they have not done much for my anxiety at all. But I just want to read out a couple of different types of them. So the most common antidepressants are selective serotonin reuptake inhibitors, also known as SSRIs. These actually help they actually give your brain, they actually create like more serotonin in your brain, which is something, it's like a theory. I don't think it actually has been proven, but there is like a theory that many people believe that if you're struggling with depression that you're lacking serotonin, and that could be a cause. Obviously there are many other factors that play into this, but that is just a theory that has been hypothesized for many years. And then there are also quite a few other ones. There are older antidepressants that were used as well, but they're not used as much anymore. They come under the name TCA, tricycle antidepressants, and don't quote me on the names because they're kind of hard to say. So I'm just going to start reading out like the pros of medication. So if you're struggling with a mental health issue, obviously it can be really difficult, and you may be in therapy already, which I would highly recommend. But if you are like already doing therapy and you're doing other stuff and you feel like you're just not getting where you want, or you're still struggling, or you're in a very like severe kind of situation, that's when I would say that medication would be best. And I'm not a doctor, so obviously this is just coming from my own experience. I don't have training in this, just as a disclaimer. But personally, the reason why I decided to finally go on medication was just because my mental health had been declining for a long time, and it just got to the point where it was getting quite severe and quite bad, and it was really just really affecting my life, and I just couldn't cope. And I was also starting therapy, but therapy is really great, but sometimes you just need like that little bit of extra help. So that is where medication came into play for me. Obviously, make sure you talk to your doctor, and your doctor will go through stuff with you. But some of the pros for antidepressants can be improving mood, it can improve your appetite, it can help you sleep a lot better, and it can also decrease, obviously, like depressive symptoms and suicidal thoughts. But there is a warning that comes with antidepressants at first, and that is it can actually make your depression and suicidal thoughts worse. So when you first start taking them, your doctor will be very carefully monitoring you, and it's always good to have somebody else around you know that you're starting a medication, because they can kind of keep an eye on you, because often, especially in young adults, the suicidal rate can actually go up. So if you're already struggling with this can be something that you just want to make sure you keep an eye on. Just make sure you keep yourself safe and stuff. So they are the main pros, I suppose. And in my personal experience, as of whether medication has helped, I would say yes, it has helped, but it is not the solution. I'm going to say that. Like, it isn't just take a pill and it's going to fix all your problems. That's not how it works. And a lot of the time, like, mental illnesses and things like this that we can struggle with come about from numerous things. They're not, you know, like a one-sided issue. Like, you know, when you start to experience this, or you develop a mental illness or whatever it is, usually there is a lot of other factors that play into this, which means that obviously it can't be all fixed by just taking a pill, unfortunately. So, you know, recovery requires a lot of other things, but has it helped me? I would say definitely. I have noticed it has helped me. I wouldn't say I noticed like a massive difference. I would say it's probably, for me personally, just been more of a small difference, although I've only been on them for 2 months. So, you know, as the time goes on, the longer you're on the medication, obviously the better your mood's supposed to be. Doctors can like change your dosages and stuff just depending on what you're struggling with and how bad things are or whatever. The thing is, this is what puts most people off, and it definitely put me off, is that you can get pretty horrible side effects from taking these type of medications. Like I said, I am on fluoxetine, and this is the first antidepressant I've ever tried. A lot of the times you will have to go on different ones to see what your body works with. Luckily for me, this one seemed to be fine, and the only side effects I experienced for the first 2 weeks were headaches. I did get quite a dry mouth, and I think that was mainly it, honestly. I was expecting like nausea and all these things, because I'd seen a lot of other people's videos and they'd all say how they had these terrible side effects and terrible, you know, all these things. I did get increased anxiety, but apart from that, I actually didn't experience anything too horrible. It really wasn't that big of a deal. But like I said, I was only on a low dose, so maybe that had to do with it. So I'm not 100% sure, but for me personally, that one worked really well. Still on it, not really experiencing any other issues with it. But some people can experience some pretty bad side effects, but they should go away as time goes on. And if the side effects are becoming really bad and it's not even worth taking the medication, I would definitely recommend like seeing if you can swap or go back to your doctor, and obviously they will take care of that. So SSRIs, antidepressants, can have these following side effects. I'm just going to read a couple out because, like I said, I didn't really experience many. You can get insomnia, dry mouth, dizziness, weight gain, headaches, sexual side effects, and there's also quite a lot of other ones to do with obviously your mental health, not just physically. And a lot of people say that they get nausea and they feel very sick from this. That's a really common side effect that most people do end up getting. So these are just some kind of like facts about them, which I thought would be helpful, because I know a lot of the time when you're trying to think of, should I go on this medication or not, like it can be really confusing, and like obviously it's a commitment. You have to take it every day, and once you start them, you can't just stay on them for a few months. Like it has to be, you know, like for whatever period your doctor says. So for me, I'm probably only gonna hopefully be on them for maybe like a year and a half, just because for me personally, the medication has been used kind of as a crutch just to help me get through that initial stage of therapy and like starting to work through stuff and everything. And I think when you're at a really, really low point and it becomes, you know, kind of concerning for your health and safety, I think that's when medication plays a major role. It's not for everyone, and if you don't take it, it's fine. I'm not saying that you need to take it. This is personal choice. Anyone, you know, everyone has to make their own mind up with this. This is just my view, and like I said before, I was quite against it just because I thought all those side effects, that doesn't sound nice. You know, honestly, I didn't really know much about them, but once I kind of got more informed, I definitely changed my mind on that. And no, I don't want to be on them for the rest of my life, but I do think they are good for certain situations where you just really need that extra help. So yeah, if you guys have any other questions on this, please leave it down below. I didn't really give too much information just because like you can Google it and find so much information online. And I think most people who have experienced mental health problems probably do have a good idea of what this medication is and used for, but you can definitely ask me any questions you want, just leave it down below. I'll be happy to answer it, and I hope that your guys' mental health is going okay. I also have a mental illness recovery account on Instagram. If you want to go check that out, it'll be linked down below. And I hope you guys have a great week. Thank you so much for watching my video.